Hey, good morning. Today we're going to talk a little bit about what our rhinoplasty consult process looks like. It's a little bit different than the facial rejuvenation consult, mostly because we incorporate imaging into it, digital imaging, and so we'll just kind of go through that process. So obviously the first most important thing about any consultation is talking to the patient and asking them what their concerns are. Here's a mirror. What is it about your nose that you feel like you want to change? And we try and guide the patient through the process of identifying what they're seeing and what that actually means in terms that we can communicate with, like projection and rotation and width and those sorts of things. So once we kind of establish what they are interested in, of course then comes a physical exam. So that includes both looking inside the nose with a headlight and a nasal speculum to identify if there's septal deviations or turbinate hypertrophy or mucosal disease or anything that would be contributing to any sort of breathing obstruction. That's followed by an external exam where we look and identify what the nasal bones are doing, what the upper cartilages and lower cartilages, and what could be contributing to the appearance of the nose that has the patient's concerns in mind. Once all that's complete, the next step is the one the patients enjoy the most, and that is that we take a 3D picture of the patient, and then using special software we can go through and morph the nose. And basically the way I do that is just right in front of the patient, and we just go through the process of morphing the nose together, and that allows us to communicate back and forth, and I can get their idea of, hey, how does that look? Is that kind of what you had in mind? Do you feel like it needs to be a little more, a little less? And it also provides the opportunity for me to provide a little bit of realistic expectations, because sometimes when you morph the nose, the patients feel like they want it smaller and smaller, or more rotated or shorter, or something that just doesn't align with what the possible actual surgical outcome is. So it's a really valuable tool to identify both what the surgeon feels like is an appropriate nose compared to what the patient feels like is an appropriate nose, and then reconcile those differences to actually come up with a realistic sort of predicted plan for outcomes. And then of course I take those digital images into the operating room with me, and I use those in surgery to try and duplicate what we talked about, because obviously it's all about trying to deliver what you feel like is the appropriate outcome. So that's the consult process here at Buckingham Center, and hopefully that provides you some insight. Thanks and have a great day.